My name is Sophie Westwood. I'm a research assistant at the University of Plymouth, working as a researcher in residence at Plymouth City Council on the HDRC Health Determinants Research Collaboration, which is a collaboration between Plymouth City Council, Plymouth Octopus Project, which represents the VCSE sector, and Plymouth University to increase the capacity for evidence-informed practice in relation to the wider determinants of health. For this presentation, I'm going to talk about the NIHR Local Authority Academic Awards Programme and other associated opportunities. Plymouth Health Determinants Research Collaboration is tasked with supporting Plymouth City Council and its partner organisations to increase their capacity for evidence-informed practice, in particular in relation to their work around the wider determinants of health. This means embedding research into the activities of Plymouth City Council and partner organisations' work. Different HDRCs are taking different approaches to this task. Plymouth HDRC is taking a Human Learning Systems or HLS approach. In practice, this means Plymouth HDRC are sitting alongside Plymouth City Council and partner organisation employees, supporting them to do research and evaluations with a focus on improving practice. In short, we are trying to support an action research or research in practice way of working, where practice and research are linked in a cycle, as illustrated on this slide. Choose whichever term you like. I will use action researcher as it reminds us of the work we are part of and just sounds less intimidating. So, evidence suggests that research active organisations deliver better services and outputs than organisations that are not research active. Action research and action researchers are integral to critically appraising policy and practice and to contribute to the development and maintenance of optimum and adaptive services. Action research cannot happen without action researchers. There is lots of research skills in Plymouth City Council already. We need to reignite those skills that are lying dormant and create a culture and way of working that allows for research to be common practice. Researchers in residence do this by working closely with people on specific projects. There is also training that people can access at various levels. The NIHR have an awards programme that local authorities and their partner organisation employees are eligible to access. The slide shows two diagrams to suit different visual preferences to illustrate the awards available depending on the level of training an individual has. So to access these awards, a minimum qualification of a degree is needed. So then the first award that you would be able to access is the pre-doctoral award. If you have a master's, you could then access a doctoral award. It's possible to access it without a master's, but with some research training instead, or research experience. And then beyond a PhD, there's the postdoctoral award, and cross-cutting all of these is the pre-application support fund, and I'll explain a bit more about these in the next slides. So these NIHR awards are a rare opportunity to study while in paid employment, and they're a great way to make research a bigger part of your career. So whilst on a pre-doctoral award for health and social care, you undertake a programme of training and development at master's level and develop a competitive PhD application while continuing to be paid your salary in full, and your employer is funded to backfill your post. So there's up to £5,000 towards bespoke master's level training per full-time year, £1,000 for working with people and communities, PPIE, £1,000 supervisory fees and £1,000 conference fees and associated travel and subsistence costs. If you already have a relevant master's degree, you can apply for a shorter award with funding provided proportional to the duration. So anyone working in a local authority or an associated setting such as supporting service in the VCSE sector can apply, and those on fixed-term contracts are also accepted. The start date is the first of the month from September to March, and it's up to a 12-month award. That's full-time. If you're full-time, applicants can request 20% paid practice time, and methodologists can apply for up to 24 months full-time funding. Part-time arrangements are available from a minimum of 30% full-time equivalent and up to a maximum of 4 years duration. So a recent round closed, and it's usually an annual call, so look out for it next year. Having said which, if you're interested, it's a good idea to start your research now and start thinking about your application now, so don't let that put you off. So the doctoral award is similar to the pre-doctoral award in that if you're employed by the Plymouth City Council or any other local authority and any of their supporting services in the VCSE sector, you're eligible to apply. You need to be working within health and/or social care, and for the doctoral award you need to have a minimum of an upper second class bachelor's degree with previous research experience and/or training, such as a master's degree. Whilst doing a doctoral award, you undertake a PhD, and you continue to be paid your salary in full while your employer is funded to backfill your post. Full-time is a minimum of 3 years. Part-time you can do up to 6 years. Again, it's 20% professional development time, 80% academic development time. Tuition fees and costs of research projects are included, and those on fixed-term contracts are acceptable as well. There should be another round opening soon, maybe a second one in the autumn as well. So look out for these. Again, it's always good to start thinking about it earlier the better. If you have a PhD, you may want to think about applying for a postdoctoral award, particularly if you're ambitious to develop independence as a health or social care researcher. Again, if you're employed by a local authority or any of their supporting services in the VCSE sector and you work within health and/or social care, then you will be eligible for the postdoctoral award. You'll need a PhD or to be soon awarded one. And you can be at any stage of your postdoctoral research career to apply for this award. The award offers you the chance to undertake a postdoctorate and continue to be paid your salary in full while your employer is funded to backfill your post. Full-time is a minimum of 2 years, and there's the option of part-time up to 5 years. 20 to 40% of the award time is dedicated to professional development, and again, fixed-term contracts are accepted. There is a round open currently. It closes in July. These are usually annual rounds, so this might be a good time to preview the application form and get to know the process and what's expected, to then think about an application for next year. It's understood that applying for one of these awards takes a lot of time. As I've been suggesting, the earlier you start, the better, even if that's a year or more in advance. And also, it's understood that the people applying for these awards are people who are in employment. And so if you're struggling to find the time to complete your award application, you can apply for an NIHR pre-application support fund, and that is applicable for either the pre-doctoral, the doctoral or the postdoctoral awards. The funding offered is up to 12 months funding, and is a contribution to your salary to buy out the necessary time for you to prepare an application. It covers conference costs, relevant training and development, mentorship and supervisory costs, and other costs that you might be able to justify in your application. Some things that you might use the fund to do are to protect your time from professional or caring responsibilities to prepare the application, to gain access to necessary research training resources directly related to your future application, such as research methods or working with people and communities. Further develop your collaborations as well as get supervisor or mentor input on your application. Work with people and communities to prepare for your planned application, and access additional support to remove barriers you would otherwise face as a result of a disability or health condition. There's three rounds for the pre-application support fund each year, so it's worth looking into as a springboard to one of the next awards. I strongly advise you to look at the application form regardless of whether the call is open or not, to give you a clear idea of what you need to do to apply. It's important for managers to be on board and to have a discussion with HRD with regards to contract arrangements, particularly if you're on a fixed term contract. Employees on fixed term contracts may still apply as long as a contract is in place for the duration of the award. So for some, this may mean HRD considering an extension to your contract, which would need looking at it on a case-by-case basis. And starting this process sooner rather than later is an important piece of the puzzle. It's likely to take many months to put together a strong application and requires a long-term planning, hence the pre-application support fund. There is support out there and it is important to access it. This is a fairly new scheme, but it is still competitive. You can have a look at the success rates on the slides, and it will become increasingly competitive as more people become aware of the opportunity. So other NIHR local authority specific awards include the First Steps programme, which is approximately 10 days training over 6 months with a mentor and funding to backfill your time and that of your mentors. Then there's the Spark, which offers a limited sum of money to support a project which might be as short as a couple of weeks or as long as several months, with the aim to gain experience in different parts of the research system. Then there's FIRST, which is an excellent opportunity to collaborate with academics for a rigorous evaluation of a project and learn from the experience at the same time. And the FEL, which is a fantastic career development opportunity. And I'll expand on each one of these in the next few slides. In the first year that we had applicants from Plymouth, there were 4 people on the First Steps programme in a range of employment levels, one of which won the Poster and Presentation Award at the celebration event that concluded the programme. It's a great introduction or refresher of the basics of research. So Plymouth had 1 applicant in 2024, and I'm pleased to say that this year in 2025 we found out that they were successful. So if you are interested in this award, do get in touch and we can share our learning. This award is currently open for applications, and there's also a link on the slide to examples of previous FIRST evaluations which I would encourage you to look at. under the first scheme, a team of academics are ready to work with local authorities on evaluation of interventions. It's emphasised that the evaluation is fully funded and not the intervention. The evaluation is typically conducted over 12 to 18 months and using mixed methods. Local authority teams that apply for the first scheme are asked to be aware that they will need to commit some time and human resource to working in partnership with the first team to co-produce the evaluation, and obviously this will benefit the team to be able to learn from the experience as well. If you work in senior public health policy or community development roles, you could apply for the FEL Award. The FEL Award would fund 0.1 full-time equivalent of your salary for an initial period of 24 months, with the potential to extend this. This would provide you with protected time to undertake FEL responsibilities, increasing capacity for research and evidence-informed practice in your team. There are a couple of additional opportunities that have come to our attention. There's the NIHR Career Development Award and the PNARC Knowledge Mobilisation Fellowship. So I'll show you a couple of slides on these. Another NIHR award that has come to our attention is the Career Development Award, which is aimed at supporting career pathways that develop existing social care researchers and support moves between practice and academia and between disciplines. This award has funding available between £20,000 and £75,000 for between 12 and 24 months. Staff and non-staff costs are fully funded, and costs for applicants' salary, training courses, events, direct costs linked to the award are covered, but supervision costs, international travel or conference attendance are not. Just to give you an idea of timelines, the last call closed in February this year, and it was expected that the activities for the award would be started within 6 months from that date. Some of the examples of what you might do with the funds are, it could be an opportunity for early career researchers to gain experience in developing and leading their own small-scale research project and to build their networks. It could provide dedicated time for development activities for both the project and the person to build and support a future research proposal or fellowship application to a funder of social care related research. It could be used to undertake a personalised training and development plan, which is clearly cemented into a research career. It could be used to undertake formal training relevant to social care research, or enhance research skills to support evidence-informed practice, or to transition from a relevant professional career to develop research skills and experience in social care related practice over the longer term. Or to adapt expertise in areas outside social care with a view to their future application in social care research. Or to encourage academics to spend time in policy or practice and practitioners to spend time in academic settings. It's expected that there'll be another round open sometime in the summer this year, so look out for that. In addition, this PNARC Fellowship will be having several follow-on calls this year, so look out for those. There's no research experience necessary to apply for this fellowship, and some of the you'll get some skills to promote meaningful change in your service informed by research evidence. You'll be provided with funding to backfill your post and training in applying research evidence. Fixed term contracts are acceptable, and flexible part-time arrangements are on offer for 12 to 36 months. So yeah, keep an eye out. So if you're interested in applying for any of these awards, please have a read on the NIHR website, the Research Career Funding Programmes pages, and contact myself or Maxine Huff, who is the NIHR Study Support Service based at Plymouth Science Park, for some support, and we can answer questions and discuss what might be most appropriate for you and your needs. And also we'll advise you to contact the Research Support Service, who will be able to support you throughout the process, and also advise you to have a discussion with your organisation's HROD and your line manager to make sure that it's practical and feasible in terms of your contract and other commitments in your role. Thanks for listening.